Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Transport across the proximal and the distal portions of the nephrons. So first is the proximal tubule. So here in the proximal tubule there is a reabsorption and the secretion. So in reabsorption, 67% of the 67% of the filtered Na plus is actively reabsorbed. That is, the sodium is actively reabsorbed. It is not subjected to the control, and chloride follows passively. Chloride, it follows passively, and all filtered glucose and amino acids are reabsorbed by the secondary active transport. So all filtered glucose and the amino acids, they are reabsorbed. They are reabsorbed by the secondary active transport, and it is not subjected to control. There are variable amounts of the filtered phosphate and the other electrolytes which are reabsorbed, and they are subject to the control. About 65% of the filtered oxygen, the water, is osmotically reabsorbed. So 65% is reabsorbed osmotically, that is the H2O, and it is not subject to control. Then when you look at, there is about 50% of the filtered urea, and they are passively reabsorbed and not subjected to control. Almost all the filtered potassium is reabsorbed and not subjected to control. So even potassium is passively reabsorbed. Next, moving on to the secretion of the PCT. So secretion of the proximal tubule, there is a variable H plus depending on the acid-base status of the body. So there is a variable H plus and S plus secretion, and this is depending on the acid-base status of the body. So there is an organic ion secretion, and it is not subjected to control. Then we move on to the distal tubule. So reabsorption is, there is a variable sodium reabsorption, and it is controlled by the aldosterone. So this is, we are talking about the sodium. So chloride, if you see, it is passive. Next is, there is a variable H2O reabsorption. It is controlled by the vasopressin. So vasopressin controls the H2O, that is the water. Then how is the secretion done? Secretion, there is a variable H plus secretion, that is, it depends on the acid-base status. So various variable H plus secretion depending on the acid-base status, and then there is a variable K plus secretion which is controlled by, so potassium, this is controlled by that of the aldosterone. To learn and grow daily like this, please do subscribe.